morning, everyone. Good afternoon, everyone, and welcome to Geriahub by Dr. Lydia. We are glad you could join us today. And thank you for, again, subscribing and following us and having the zeal and the desire to learn more about healthy aging. So today we are talking about a very important topic as well. We're talking about the skin, right? And we really want to make sure that we have great skin throughout the aging process. And what we know is that the skin will, of course, change as we age, especially because we spend so much of our time outdoors, especially for us in Kenya and Africa, because we're in the tropics. We really have a lot of exposure to the sun. And as we know, the sun has its benefits. It gives us vitamin D. And vitamin D is very important for our bones and for boosting our immune system. But we cannot forget that vitamin D can also dry and age the skin. And so while sunshine is important, excessive exposure to sunshine can also accelerate wrinkles, drying of the skin, age spots. We're going to look at age spots, bruising, and can even cause skin cancer. And so it's so important that even as we go out to the sun, that we learn the etiquette associated with sun exposure so that we protect our skin. Okay? And there are also other potentials that are around us that can affect our skin. For example, dehydration. Do we take enough water? Anytime you don't take enough water, one of the areas that will show is the skin. How do we know this? Because your lips become dry and your lips are part of the skin. And so one of the areas that really suffers from lack of water intake is the skin in general. Smoking is another one. And if you've noticed and you're keen, you'll realize that a lot of smokers have dry lips, right? Because smoking has an element of dehydration and just affecting the skin in a negative manner. The next one is stress. And you know, people always say, sabuni pesa inaosha watu. I beg to differ. What I think happens is that anytime you have money, it gives you freedom and it gives you the opportunity to enjoy your life. But anytime you have stress, and we had spoken about stress before, when you have prolonged exposure to stress, then your body produces stress hormones. And the stress hormone that is produced, prolonged exposure to stress, is called cortisol. And actually, this cortisol causes darkening. And if you find someone and they probably have a patient in the hospital who has been hospitalized for long, or you find someone who has been in a stressful situation for a long time, what you'll realize is that they look darker. Yeah? And even yourself, if you go to your photos from your past, yeah, the times when you were stressed, when you look at that photo, you'll realize that your skin was hyperpigmented. It was darker than what it is. And immediately you became happier, or the stress resolved, you become lighter. And that's because the stress hormone disappears. That cortisol disappears. And so stress negatively impacts our skin health. And of course, other things. And so I won't go too much into the skin and the anatomical components. I'll just quickly dive into the things we need to do to protect our skin. And the first thing, of course, is to limit our time in the sun. You even when you go to Mombasa for the holidays, I know we like to lie in the sun, and especially when the sun is hot, so that you can optimize the sun's rays and feel nice. But a lot of that sun exposure damages your skin. And so even when it's hot, even during the summer, try and stay out of the sun at least from 10 a.m. to 4 p.m. because that's when the sun's rays are strongest. And then don't be fooled by cloudy skies. Sometimes we assume that because it's cloudy, that the sun's UV rays cannot come through and cause damage. We are here to tell you that even when it's cloudy, the sun's rays can go through the clouds and still cause damage. And so what we are saying is practice taking care of your skin, whether it's cloudy or sunny, okay? Number 2, use sunscreen. And sunscreen has something called SPF, which is the sun protection factor. And we want you to get a sunscreen that has an SPF factor of 15 and above. That is the one that will be beneficial to your skin. Put on sunscreen 15 to 30 minutes before you go outside. Remember, we said whether it's sunny or cloudy, the sun's rays are able to come through and they will affect and adversely injure your skin. Number 2, reapply your sunscreen every 2 hours. Very important. Number 3, especially when you're swimming or you're indulging in any other activity, or you're sweating, or you're rubbing your skin with a towel, you keep reapplying the sunscreen. So what we've said, when you're leaving your house, put on sunscreen. Put it on 15 to 30 minutes before you leave your house, and then reapply every 2 hours. Okay? Number 3, in the absence of sunscreen, wear protective clothing. Wear long-sleeved shirts or t-shirts. Make sure you have a hat that protects your neck, your eyes, your ears, your nose, especially some people who get sunburns on the nose or your cheeks. Just find attires or protective clothing that keeps you safe. Put on a long dress or a trouser so that your skin has less exposure to the sun. Number 4, and this one is very close to my heart, avoid bleaching. Some of these bleaching chemicals are very harsh to the skin, and once they have caused the damage, most of this damage is irreversible. What these bleaching agents do is that they come and corrode and get rid of this top layer of the skin. And this top layer, the dark layer of the skin, is the one that is responsible for a lot of protection from the sun's UV rays. So when you bleach yourself and then you look lighter because you have removed this top protective layer of the skin, it means you're just leaving yourself vulnerable to the sun's UV rays, which then damage your skin and cause injury. So let's reduce tanning. Let's reduce bleaching, especially using bleaching agents that have not been approved by the healthcare regulatory bodies. Number 5, let's talk about skin cancer. This is a very important topic. I know a lot of Africans think that they can't get skin cancer, but we do have people who have gotten skin cancer. We do have populations that are vulnerable and are easily affected by skin cancer. For example, the albinos. And so it's important that number 1, we protect ourselves from the sun, but then number 2, we be on the lookout for any lesions or skin marks that may predispose us to skin cancer. If you have a lesion or a black spot, I know we call them black spots, make sure that it's not asymmetrical. Whenever you have a lesion and it's a nice perfect circle, that's a good lesion. When it starts becoming amorphous, it's not circular or oval, then know that lesion has a problem. When that lesion starts having borders some are raised, some are flat, some are irregular, it starts bleeding easily, know that is not a good lesion. You need to go and have it checked out. When you have a lesion that has more than one color, there's a problem. When you have a lesion that has the diameter more than the diameter of a normal pencil, you have a problem. And finally, when you have a lesion that is evolving, today it's itchy, tomorrow it's painful, the other day it was bumpy, today is bleeding, the next day, like it's always changing, then you have a problem. And to remember these things that we need to look out for, we use a simple acronym ABCDE, and we've spoken about the asymmetry, the borders that are irregular, the color changes that may take place, the alterations in the diameter, and finally the evolving nature of the lesions. And there's a diagram here that you'll be able to see more clearly what I'm trying to say. where we have the asymmetry. You can see that the lower ones are very asymmetrical. The upper one is nice and round. When we come to B, the border, the lower one does not have a border, and that is the bad lesion. It's the melanoma lesion. In the upper one, we have a skin lesion that has a nice border. When we come to color, the bad one, the melanoma lesion, has many colors. Yeah? But when you have a lesion that has one color, that is a good lesion. The diameter, when you have a melanoma lesion, it keeps growing in size, yeah? And we don't want that, because when it's growing, it means it's also spreading. It's a cancer. It's a form of skin cancer that is spreading. And so you'll be able to see the differences in this diagram. And lastly, the evolving nature of the skin mole. This diagram is showing how the mole is changing, how it's increasing in size. And so when you use the acronym ABCDE, you're able to monitor the possible skin changes that can alert you and tell you whether a lesion is a normal skin lesion or a cancerous melanoma type of lesion. Yeah? And so when you find it, please go to the doctor and have it checked out as soon as possible. Number 6 is wrinkles. I mean, we all get wrinkles. We all have laughing lines and worry lines. For those of us who like creasing our faces, wherever we crease our face, we get some form of lines, and it is normal. Over the period of time, our skin wrinkles, right? And there are things in the environment that increase the rate of wrinkling. For example, the sun's UV light, dehydration, of course, gravity. Gravity causes the skin to sag and wrinkle, and certain habits like smoking, right? But then there are many things that people talk about that they say can reduce wrinkling, you know, the use of some chemicals and all that. What we say is that in the long-term period, exercise has a role in keeping your skin healthy and strong and elastic. And all these other methods should be prescribed to you by a doctor. If you want to reduce the wrinkling, go to a doctor who can then be able to advise you to remedy that in a manner that is healthy. Go to a doctor called a dermatologist. Those are the doctors who manage the skin. What are the natural remedies for reducing wrinkling? Number 1, drink your water. Stay hydrated. The more you drink water, the more elastic your skin is, the more healthy and young your skin will be. Number 2, take antioxidants, vitamin E, take your green vegetables, take your fruits, take your green tea, very rich in vitamin E. All those are antioxidants that will keep your skin rejuvenated and healthy. Number 3, moisturize. Nowadays, we have skincare regimes that are all over. Please find a moisturizer that is natural. You can use aloe vera or coconut oil or any other that works for you. Number 4, make sure you do facial massage. And there are a number of facial massage protocols that you can use. There are some that you can rub your chin, you rub your cheek, you rub your forehead, you pull your skin up. And you should do these regimes 5 minutes every morning, 5 minutes every evening. And continuous practicing of these facial massages helps to keep your face healthy and your skin free of wrinkles. Of course, use your sunscreen. I can't overemphasize that enough. Maintain a healthy lifestyle. Go to the doctor when you need to go to. Take a balanced diet. Go to a dermatologist whenever you need to. And then when you're at home, you can do some of these DIY masks that are natural. Put honey on your face, you know. Put yogurt and avocado on your face. All those are natural, and they have chemicals, natural chemicals that are beneficial for maintaining our skin health, okay? Next, we go to age spots. There are something called age spots. Age spots are dark brown marks that just naturally occur on the skin, right? They are more visible, of course, in the white people or very light people. But as we age, we find that they have some areas that just become darker or more hyperpigmented. And these are flat brown spots. They're not itchy, and they're often caused by continuous exposure to the sun, right? And they show up in areas that are sun exposed: your face, your neck, your hands, maybe your legs if you wore short dresses or something like, or shorts. And they're normal and they're harmless. And so what we are saying is that whenever you use sunscreen, you protect yourself from the sun. And as we've said, these age spots come because of exposure to the sun. And so what are we saying? We are saying that age spots can be prevented if we take good care of our skin. And if you have age spots, how do you manage them? You just go to the doctor and they do laser treatment on you. That one, there's no home remedy for age spots. And lastly, we have skin tags. Skin tags are these tags that people have on the neck. They're sort of protruding. They're small, fleshy. They have a raised surface. Some have black ones on the skin or on the face. And some have, I don't know that to call it colorless or light cream. They're always found on the eyes, on the neck, sometimes on the body folds, such as the armpit, the chests, or the groin areas. They're also harmless, but for aesthetic reasons, they make us uncomfortable, right? We don't want to have them because they make us look. Sometimes it's not the look that we want to have, right? And sometimes when, as we've said, they can be found in the folds of the skin. When those folds sometimes are exposed to sweat, some of those skin tags become irritated and itchy. And so if these age spots and skin tags bother you for whatever reason, please go to the doctor who can safely remove them for you. As we said, a dermatologist is your best bet. And for this skin tag, the protruding skin tags that we have spoken about, the doctor can sometimes cut them off, yeah? Or the doctor can burn it off. There's a way they can burn it off. It's called cauterization. Or they can even freeze it off. And after freezing, it falls off. And that is called cryosurgery. So the doctor will know how to manage and how to maintain that for you. And so what we are saying is that as we age, one of the things that gets affected is our skin. And one of the biggest culprits in this aging process of our skin is the sun. And so one of the things you can do to protect yourself is to put on sunscreen every day, whether the sun is there or whether it's not. As we've said, even when there are clouds, the UV rays can pass through the clouds and affect our skin. So put on your sunscreen, or you put on long clothes that are then able to protect you from the sun. Drink your water, stay hydrated. 2 to 3 liters is acceptable and ideal for us, for most of us. Eat your fruits and vegetables, especially the ones rich in vitamin E, your green leafy vegetables, your fruits and your green tea. Excellent sources of vitamin E for you. Manage your stress. Remember, we said anytime you're stressed, your body produces cortisol, which makes you darker and negatively impacts your skin. No smoking. And consistently, we will be able to see that anytime we are talking about aging, smoking and alcohol negatively impact how well we can age, okay? For the ladies, of course, and the gentlemen, moisturize. Moisturizing is excellent for your skin, keeps it supple, keeps it soft. And you can use aloe vera or coconut oil, olive oil, or any other natural oil that you have or what works for you. And finally, because some of this, even some of this diagnosis, some of these things that we have spoken about, for example, melanoma, skin tags, because sometimes you might be confused and might not be able to diagnose them easily, please make a point of going to your dermatologist at least once a year so that they can check you up and be able to come up with solutions in good time, yeah, so that you're able to mitigate some of these changes before they become they are too far gone. So thank you for joining us for today's discussion. I hope we have learned that the skin is a very important organ in our body and that we need to take care of it. We have also learned that gravity is real and that it pulls on our skin and causes wrinkles and sagging, but that with consistent exercise, we can be able to reverse some of these changes. Please follow us, please comment, please like, please let us know if you have any other topics that you want us to discuss, and keep engaging with us because we appreciate that you're able to be here with us and to enjoy this content that we keep talking about. Please have a good day and thank you very much.